Hi, this is Dr. Thomas Burnett at Regeneration, Pittsburgh, and today we're talking with Tammi. Tammi, thanks for being here and telling us about your story and your procedure. I really appreciate it. But just to give you the backstory on Tammi, I've known you for a long time, and a couple years ago you came in with real bad left hip pain. I know you had the surgery back in 2003 for the left labral repair, and then you went to see a surgeon again, and I think that at that point they recommended the repeat surgery potentially. And we decided to try to avoid that, and in January of 2017 we did the bone marrow aspiration, the stem cell procedure, and injection into both the hip and the greater trochanter on the side, on the left side. And can you just tell me how things have gone since that time, how you're doing?
I'm doing actually very great. I'm back to 100%. I have no groin pain, no left outer hip pain. I am back to doing my regular exercise routine, taking the steps, wearing my high heels.
Yeah.
And I'm a nurse practitioner, so it's been a great experience.
That's good. I love to hear these stories too. So, and I guess the second story, would you recommend this to somebody in a similar position with similar complaints with the left hip pain?
I would highly recommend it. I didn't want to have surgery again. I was very nervous. And then you told me about this procedure. I knew it couldn't hurt, and I'm very glad I did it.
Perfect. Well, thank you again. Thank you very much for offering to talk about it.
Sure. Thank you.